50 years ago, social workers across Ontario established a provincial association that would advocate for the profession and social justice. It would provide members with an opportunity to share knowledge and enhance the influence of the profession. And so, the Ontario Association of Social Workers was established. Today, we have a healthy, vibrant association. Members come from all parts of the province and all fields of social work practice. This presentation, covering the last 20 years, provides a brief retrospective of our journey and highlights a sampling of key issues and activities in each decade. The 1990s was a turbulent time, both politically and economically. Bob Rae's NDP government assumed power during a major recession and oversaw an era of job loss, hiring and wage freezes, and funding cuts. In 1995, the election of Mike Harris's Conservative government and his common sense revolution led to dramatic cuts in social programs and massive restructuring in healthcare. In 1992, OASW responded to a consultation paper on a housing framework for Ontario and held a press conference at Queen's Park in response to Premier Rae's economic address. We subsequently made a written submission on social welfare reform, expressing serious concerns about the adequacy of the proposed benefits. As well, in 1992, we published our first handbook on the issue of elder abuse. In 1995, to counter Harris's government's draconian approach to social assistance reform, we produced a position paper on workfare in Ontario. During the decade, OASW was one of the only professional associations to speak out in the media in favor of same-sex couples gaining access to spousal benefits, and we lobbied MPPs to end this discriminatory practice. In the mid-90s, we developed a policy statement on promoting equity for lesbians and gays. In the mid-90s, discipline-specific departments in hospitals were dismantled, and the program management model was implemented. OASW was involved in 2 research projects on program management and held forums for social workers to discuss the implications for practice. In 1992, based on political advice that the independence of OCCSW was necessary for the Volunteer College to fulfill its mandate of protecting the public, the 2 organizations formally separated. In 1994, OASW launched Social Work Week as an opportunity to celebrate the role and contribution of the profession. The first week of March has been embraced by the profession, with events being held across the province within schools of social work, agencies, organizations, and branches. In recent years, the vital role that social work plays in society is acknowledged in the provincial legislature and recorded in Hansard. In 1995, the word professional was removed from the association's name to bring the Social Work Association in Ontario in line with sister associations across the country. OASW provided input to the development of the Substitute Decisions Act, 1992, and the Healthcare Consent Act, 1996. Advocacy by the profession to ensure the inclusion of social workers in regulations was imperative because not only was social work not regulated under provincial legislation at that time, but these regulations were under the Regulated Health Professions Act. 1998 saw passage of the Social Work and Social Service Work Act, the culmination of strong, focused, and active leadership by the association over a 20-year period. The 2000s was a period of unprecedented economic uncertainty. Optimism spurred by a steady, albeit slow growth in employment rates early in the decade, was followed by the global financial crisis in 2008 and a dramatic downturn in the economy. Pressure on organizations to restructure intensified as they looked for less costly ways to do business. In human services, workloads increased, while salaries and working conditions eroded. Campaign 2000 remained an ongoing commitment, as did our advocacy for Ontario's poverty reduction strategy, which was introduced in the fall of 2008. In 2009, OASW published a second edition of its Elder Abuse, a practical handbook for service providers. During the decade, OASW was involved in a number of initiatives advocating for more equitable treatment for First Nations children living on reserves. Additionally, advocacy efforts related to improving housing and education on reserves. Proclamation of the Social Work and Social Work Act 1998 in August 2000 was an important milestone celebrated within the profession. As a result of growing concern about what erosion in working conditions and salaries within the profession was bringing about, OASW conducted an online survey to gather information about these matters. In December 2006, a report on the survey findings were widely disseminated. When social work was left out of the draft Psychotherapy Act in 2006, OASW successfully spearheaded an intensive, multi-pronged, province-wide campaign to lobby the Minister of Health and secured inclusion of social workers in the Psychotherapy Act 2007. We subsequently successfully lobbied, together with sister associations in other provinces, to achieve GST/HST exemption for the provision of clinical social work services. Which brings us to today, an era that has, to date, been marked by slow economic growth, massive provincial deficits, and ongoing rounds of restructuring and job cuts, especially in healthcare, where over 60% of social workers practice. This has led to growing fears about the erosion in the profession's role. An ongoing theme in OASW's advocacy has been the significant negative implications of the social determinants of health and the need for increased government funding to address the root causes of social and economic inequities that undermine health and social well-being. OASW has also been actively involved as an organization and as part of stakeholder groups in advocating with government to implement progressive reforms to social assistance and the Ontario Disability Supports Program, as well as to increase the minimum wage. OASW has increasingly framed social work's contribution to health care as tied to addressing the social determinants of health and positioning the profession as a cost-effective alternative to more expensive medical alternatives. In 2011, after a lengthy period of deliberation, OASW suspended membership in the Canadian Association of Social Workers. OASW successfully lobbied the provincial government to grant individuals who have received a doctorate in social work and provide clinical services access to the title doctor. In 2012, after years of lobbying by OASW, the Income Tax Act recognized clinical social work services as a medical expense which could be claimed by the public as a tax deduction. OASW has much to celebrate on its 50th anniversary. Over the past 5 decades, the association has provided strong, visionary leadership, which has resulted in increasing recognition of the profession in important legislation, regulations, policies, and programs. Promoting the social work profession's role and contribution has been a constant theme over time, as has been advocacy for vulnerable and marginalized populations. In 2014, as in 1964 when OASW was formed, there remains a vital role for OASW as the voice for the profession.